Mr. Speaker, may I have your permission to answer questions number 1 and 2 today on the order paper?
Please go ahead.
Sir, our laws do not prescribe the permissible legal age for a young individual to seek mental health services or other medical services without parental consent. However, it is generally good practice for parents to be involved when mental health services are provided to young people. Part of the reason is that parents play a vital role in supporting their children's well-being, and their involvement to their children's recovery journey is critical. There have been feedback that the requirement of parental consent is one of the reasons why young people with mental health challenges hesitate to seek help. And indeed, the issue of requiring parental consent before seeking help and involving parents as part of the recovery journey need not be conflated. MOH has convened an expert group to study this issue and develop guidelines on the subject. Key stakeholders, including parents, youths, and service providers were engaged, and their views will contribute towards shaping the guidelines. One of the key issues we need to examine is whether for lower-level intervention that involves mostly befriending and emotional support, no parental consent may be required. However, if the objective is to encourage youths to step forward to seek help with their mental health challenges, this will need to be coupled with more proactive engagement and outreach to those who may need help. We will provide more details when the guidelines are ready early next year.
I'd like to make a clarification because SMS spoke about emotional support. I think that's Tier 1 support. We're actually asking about the Tier 2 low-intensity services such as counselling by licensed practitioners. That's one. And then do you have a clearer timeline on when the update will be and will the findings be made public on this review? And then also, I also want to check with SMS that if there's no prescription on age, as my understanding is with working with social service agencies, they also tend to feel that the requirement for this is quite opaque, and what is the direction that MOH will take?
I thank the member for his supplementary questions. In terms of timeline, we will try to conclude the work of consulting for stakeholders and put up some framework or guidelines, hopefully by early next year. As you can understand, this is a process that requires us to engage stakeholders and understand from their perspectives what would be helpful and what would be more of a deterrent. So we will do this work seriously and put up something hopefully by sometime early next year. Now, in terms of the different situations in which services needs to be provided and how caregivers, including counselors and social service agencies, can navigate this space and be clear about what kind of roles they can play, I think what we'll do is that provide this guideline, which will give a framework where the service providers can be better guided in assessing the situations in which minors seek mental health support. Now, while I said earlier that parental support is a preferred approach for some of these services to be delivered, the guidelines does recognize that there may be specific circumstances in which requiring parental consent would deter a minor from seeking the help that they need. So it is a balance that we need to strike. On the one hand, we want parental involvement, but sometimes the situation in which the minor seeking help, it could really be linked to their relationship with their parents as well. So we do need to kind of take a very sensitive approach to this, and I hope the guidelines and the framework will give the service providers better clarity on how to navigate this space and be sensitive to the needs of both parents and children.
Thank SMS for his reply. I'm asking this in the capacity as a member of the PAP Mental Health Group. In my interaction with the social service agency, one of them raised this concern: how do we ensure that those that are below 18, that as long as they're below 18, that this will be adopted? Meaning that if they're below 18, no parental consent will be needed. So from the SSA perspective, they do not need to reach out for parents to get their consent. Because when this is being adopted, then this will ensure higher accessibility to mental health services.
So as I said earlier in my reply, that there is no legal requirement for consent even today. Right? But what we want is to provide some guidance so that the SSAs can be sensitive to the needs of both the child and the parents, and as good practice to involve the parent sometime along the journey. Perhaps not right at the beginning if it feels that it is quite sensitive for the child to really even approach them for some assistance, but somewhere along the way, after a few consultations with the child, when the child has developed more confidence in the process and the counselor assessed that actually it is the right time to bring the parents into that recovery effort, then I think that's where the sensitivity needs to be applied and involve the parents gradually along the process and reconcile any challenges that the child may have with the parents, if that's indeed the source where the mental stress is for the children. And I think this is a process we need to rely on the expertise and the experience of the counselors themselves to do this with sensitivity.